Okay, welcome back. Uh, for this episode, we want to take a look at the same exercise as last time, the 90-90 hip lift, but this time we have a couple of different looks at the 90-90 hip lift. And the reason for that is many people are finding that when they try to pull down on the wall or they try to get the breathing right, that some of those things just are difficult to kind of engage in the first couple of sessions. I've had clients who have literally worked on getting the mechanics of this exercise correct for 2 and even 3 weeks, and they have enough lumbopelvic dysfunction that they are having trouble engaging the correct areas. So one of the first things that we want to deal with is that left oblique. Usually on one side or the other, if there is significant lumbopelvic dysfunction, some of the support and control that we need from the thorax, from the trunk, should be coming from the obliques. And so in this case, I've had several clients who have had difficulty engaging that left oblique. So in order to do that, we simply raise the hand toward the ceiling. Now, it's not going to be a big change. You may not feel a whole lot of difference between this and not raising the left arm, but what you will notice is if you take that right hand and just cross it over and kind of poke into that left oblique, you'll notice that that begins to engage. And again, that's very common when we have one side, one hamstring that maybe is not as involved as the other. If we're looking at a lumbopelvic complex that is more forward on one side than the other. So in this case, I'm assuming that the left side of my pelvis is more forward than the right side of my pelvis. I want to include that left oblique in this exercise, use my diaphragmatic breathing to include that left oblique in this exercise, get more support through the lumbopelvic complex from that side of my thorax. So this is the same exercise as before. The only difference is we're raising that one side. In this case, we're raising the left hand toward the ceiling, and that is going to bring in that left oblique just a little more into the exercise, a little more deliberate activity of that muscle in this exercise. But nothing changes. Just make sure that you're pulling down on the wall with those feet. You can feel both hamstrings engaged equally. You're squeezing this ball 30 to 40% effort. The tailbone has lifted off of the floor as you've rocked those hips toward the ceiling, and the low back is still engaged with the floor. You feel the low back round out and press into the floor. Okay, we'll move on to the next one. Okay, so let's move on to the next variation. So for this next variation, again, we're still dealing with the left side. We're still assuming that we're having a little more difficulty with that left side, that left hip being forward than the right. And so again, same setup. This time the hand is not in the air. What I'm focused on more is the left side of this pelvis. Now, remember, we're still talking about regional interdependence here. So if the left hip is pulled back and the right hip is reaching forward and the left knee is a little lower than the right knee, that means we're moving both sides of this pelvis. So we're working more on external rotation of the right hip and internal rotation of the left hip. Again, we're still 30-40% effort squeeze between the ball. We're still pulling down with those feet. The low back is still flattening. The first thing we do is flatten that low back into the floor and rock the pelvis, rock that sacrum off of the mat. So once we're there, we're going to very gently squeeze the ball, pull that left hip back, reach the right knee forward. So we're not rocking off to one side or the other. Those knees, those thighs stay as vertical as you can keep them, straight up and down, but we're going to find that internal rotation of the left hip, external rotation of the right hip, and we're going to use our diaphragmatic breath in through the nose, out through the mouth. 4 breaths is 1 set. And again, if we've chosen this exercise for you, same thing, 4 breaths, 4 sets. All right, now we'll move on to the next variation. Okay, so for this next variation, I want to start in this basic 90-90 position, and I just want you to see how this setup is. So the feet are about 4 or 5 inches apart, the knees are 4 or 5 inches apart because of that ball. I'm in this classic 90-90 position, the starting position, and we are going to modify this now so that we have greater anterior compression of the lumbopelvic complex, which will allow us to gain better internal rotation through both hips, the left and the right hip, better internal rotation through the pelvis as a whole, through both sides, the right ilium and the left ilium, which will allow us a little more room to decompress the very low lumbar spine and the top of the sacrum, those sacroiliac joints. So we're going to go into this setup now, and what you'll notice here is that I have placed both feet into, both hips into both hips into an internally rotated position. If the feet are pointing out, if the feet have kind of kicked out to the side, that means we're looking at the top of the thigh, and both thighs, both hips are now internally rotated. And so once again, we're going to use that ball to engage those adductors. The hips are internally rotated, increasing anterior compression of the lumbopelvic complex. That will in turn, as we use our hamstrings and our adductors, that will in turn allow that very low lumbar spine, as well as those sacroiliac joints and that tailbone, to decompress even more effectively. Okay, so now that we're ready, now we have the setup correct. We have the knees and the hips at the 90-90 position. We've got the ball between the knees, 30 to 40% squeeze there. And the hips are still lifted, that sacrum, that tailbone is still off the floor, the low back is still pressed into the floor. But the big difference here is those feet are out to the side, both hips are internally rotated. So again, that's going to create more anterior compression through the lumbopelvic complex. That is also going to facilitate a better decompression of the very low lumbar spine, getting more relative motion through that sacrum, through those sacroiliac joints, creating better internal rotation at both hips. The exercise, the breathing pattern is exactly the same, in through the nose, out through the mouth. Okay, so let's wrap this up. Once again, what we're really dealing with here is a variation of that basic 90-90 hip lift exercise. With these variations, we have determined that you need a slight modification, and that modification is going to better allow you to decompress the lumbar spine, restore motion, not just to the hips, but to the lumbopelvic complex as a whole, those tight and sore and sometimes painful sacroiliac joints. And so once again, it's so important that we make sure that we get the diagnosis correct, make sure that we know what you're dealing with so we don't use the wrong variation of this exercise, which may actually cause more problems for you and make it a little more difficult to recover. Thanks so much for watching. Get in contact with me if you have any questions, and I will talk to you again soon.